Let's kick off the summit with a message from one of our healthcare champions in Congress, Congresswoman Lauren Underwood, representing the great state of Illinois.
Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I would like to thank Young Invincibles for inviting me to join you for this Outreach and Enrollment Planning Summit and for all the important work you do to ensure that every American, particularly young adults, has access to high-quality, affordable health care. It's a mission I share with you, and it's a priority that I've been working on my entire career. As a registered nurse, my first job after graduate school was at the Department of Health and Human Services, where I helped to implement the Affordable Care Act. Thanks to the ACA, 20 million people gained coverage who would have otherwise been uninsured. People like me with pre-existing conditions can no longer be denied care, and essential health services are finally accessible, from mental health care to preventive services to pediatric care and so much more. As we reach 10 years of marketplace open enrollment, the ACA is stronger than ever, and that's thanks to legislation I wrote, the Healthcare Affordability Act, which was first enacted through the American Rescue Plan. My bill expands advanced premium tax credits to make healthcare more accessible and affordable for millions of Americans. Thanks to this legislation, we've seen premium costs for a family of 4 with marketplace coverage decrease by an average of $2,400 per year. And record numbers of people are enrolling in coverage. More recently, we passed the Inflation Reduction Act, which will extend these historic gains for another 3 years. This progress has been made possible by advocacy from organizations like Young Invincibles. But the record enrollment levels we've achieved also wouldn't be possible without the tireless efforts of the outreach and enrollment community. Thank you for all that you've done to help people in your neighborhoods get covered and gain access to high-quality, affordable health care. As we enter the enrollment period for 2023 plans, your work is as important as ever. I am so grateful for your commitment to the mission of ensuring every American can access the care they need and deserve. I wish you all the best at this summit and the work ahead of you during this open enrollment period. Thank you again for the opportunity to join you today, and take good care of yourselves.
Awesome. Okay. With that, we will start our first session, which is our policy landscape looking ahead. So I'm going to go ahead and share my screen. Actually, Elio, can you allow me to share my screen?
Should be ready for you to try it. Give it a go.
Yep. Awesome. Okay, great. So again, everyone, this is Martha, your Health Policy Director here at YI, and we're just going to have a very broad overview of what healthcare policy is looking like nationwide. Many of these topics, we will actually have more in-depth panels in this summit, so I encourage you to look at the agenda, look at the sessions in the Zoom events, and see if you're interested in joining. Hopefully you'll join all of them today and tomorrow, where we'll have more in-depth discussions on this. But this will give you a broad overview so you can start thinking of any questions that you have, or start thinking about how these will affect your day-to-day work once open enrollment starts. So to set the scene, like I mentioned before, the national uninsured rate is at a historic low. This is something that we can all be very, very proud of because of the wonderful work that we've been doing. Despite lack of funding for navigators throughout the past couple of years, we're finally receiving that funding again, and it cannot be more useful, especially now with the pandemic. There is still a long way to go, I know that internally at YI, when we talk to young adults, affordability is still an issue, especially for those who are using their health insurance often. And then we can see that there are uninsured groups, especially among communities of color and especially Latinos and African Americans and the Asian American population that have the highest rates of lacking health insurance. And so there is still a lot of work for us to do. Congresswoman Underwood did a great job of highlighting the importance of the Inflation Reduction Act, which has been signed by the president. And I just want to give another overview of this. So like Congresswoman Underwood highlighted, one of the main provisions is that starting this enrollment season for 2023, we will continue to have the American Rescue Plan subsidies. About over 90% of people on the ACA exchanges have seen reductions in their premiums thanks to these subsidies. The average savings per individual are around $70 a month in premiums. I know in some states it's as high as $80. Yearly, Americans have saved about $800 when it comes to premiums thanks to these subsidies. So we have a 3-year extension through 2025. We will definitely be advocating for Congress to ideally make these permanent, especially for young adults. Many are only having to pay $6 in premiums thanks to these subsidies. So it's made a huge, huge difference in making healthcare more affordable. Of course, premiums are only a part of it. We also had to address other out-of-pocket costs and deductibles. But with this extension, 13 million people will avoid huge premium hikes. I know that many of us are not doing a lot of work in terms of Medicare, but it is important just to be in the know. So the IRA also caps insulin out-of-pocket cost to $35 a month for Medicare, seniors on Medicare. And what's significant about that is that in this legislative push, originally we were trying to have this $35 a month cap applied to all insurance plans under the exchanges. Given the procedures that were used to pass the IRA, that was not allowed, but it had to do more with the reconciliation rules than it did with, the realities that we can't keep pushing for these sorts of caps. It just takes a lot of advocacy and organizing. So I hope that in the future, we will be able to see some of these provisions trickle down to the ACA exchanges. Under the IRA, seniors will also receive free vaccines, free of cost sharing, and there will be some policies to discourage drug companies from raising their prices at a higher rate than inflation. Also really important because we're hoping that drug companies, I don't really like trickle-down politics, but this is the one space where I will use it. What happens in Medicare really can have an effect on ACA exchanges. So we're hoping that we will be able to see some of those reductions over the years across the board as well. In 2025, we will be seeing a $2,000 cap on Medicare Part D. That's the prescription drug category. So that will be very significant as well. And we will see into 2026, the ability for Medicare to start negotiating drugs. Also something that we hope will trickle down in terms of the prices that insurance companies decide to accept for drugs. Unfortunately, the Medicaid expansion fix did not make it in. Essentially, what had been proposed in the IRA was to create sort of an ACA fix where people could buy into Medicaid, qualify for Medicaid as if the state had expanded Medicaid under the ACA. Unfortunately, that did not make it in. It was purely out of politics in that case. So again, there's a lot of work that we have cut out for us in order to kind of take some of these wins that we saw in Medicare and expand them to everyone, and also continue to fight for the expansion of the Affordable Care Act and Medicaid expansion. Something that I will note is this case going on in Texas. So in this month, or earlier this month, a district judge, many of you may have heard of him, Reed O'Connor, ruled that there are certain services under the ACA that are currently required that they find to be unconstitutional. Those services include cover for PrEP, which prevents the transmission of HIV, contraception, the HPV vaccine, which prevents cervical cancer, and other screenings. This is obviously another attack on the Affordable Care Act, and we've seen many of these attacks in the past. The judge also, let me go back, argued that basically the U.S. Preventive Services Task Force and the recommendations that they put out for what should be required to be covered by ACA plans is unconstitutional. Under the ruling, they did allow women's and children's services immunizations to remain constitutionally okay to be required for ACA plans. I will say that this ruling is not in effect yet. The judge is still reviewing information and recommendations. And so we're unclear if it will ever really take effect because we're expecting it to be appealed in the Fifth Circuit. It is concerning because we know that if this case keeps going ahead all the way to the Supreme Court, we do have a conservative Supreme Court. So it's something that we are watching, but it's not something that in this open enrollment season, you have to tell people that all of a sudden their screenings for cervical cancer are not going to be covered. It is a huge threat because 150 million people benefit from these services, but it's something that we're monitoring. It's something that we just want you to be aware of. And it's very common for these cases to come out of Texas, unfortunately. But hopefully it does not go any further into implementation or anything like that. I'm also going to go through some rules that we are also monitoring, and one that we are very excited for is fixing the family glitch. So as many of you know, the family glitch happens because if many people who are on employer-based insurance are not able to qualify for ACA subsidies based on a rule that determination is only based on their coverage being affordable and not whether or not their entire family's coverage is affordable. So there's a new rule under the Biden administration that's been proposed that would allow people to basically have the determination if they are eligible for ACA subsidies be based on what the expense looks like for the entire family. So this could help about 5 million people be able to join the marketplace. And so we're really monitoring this. We're expecting a decision anytime soon, a final rule on this, because the comment period ended in June. And so hopefully very soon, we'll be able to offer some great news during this open enrollment season to people. Next is the Medicaid SHIP enrollment proposed rule. That rule was just recently announced. Comments are due November 7th through the Federal Register. It essentially will make staying on Medicaid enrollment and staying on Medicaid a lot easier. For example, you will be able to conduct renewals no more than every 12 months. There will be a minimum 90-day reconsideration period after termination for failure to return information needed for redetermining eligibility. And it will eliminate required in-person interviews. It will make SHIP beneficiaries be able to stay enrolled without a lockout period for failure to pay premiums. And it will just clearly define the types of eligibility determination information and documentation maintained by states, which we know there's just been a severe lack of clarity and parity when it comes to that. So there are many wonderful things proposed in this rule. Feel free to check it out if you have any strong opinions. You guys are on the ground, and I'm sure we'll feel like a lot of these suggestions resonate. But if there's anything missing, let us know. And then the other rule is the 1557 proposed rule. This one has to do with essentially providing non-discrimination protections based on race, color, nationality, age, sex, disability, but specifically also on gender identity and the LGBTQ community. A lot of this, unfortunately, stems back to our judge in Texas, who has, we've seen courts in Texas essentially try to find ways to poke loopholes in the ACA so that people can be discriminated against. So what this proposed rule under the Biden administration will do is just strengthen those protections, so that we are not seeing specific communities targeted through different rulings in the courts. So that comment period ends, pretty soon, next week in October. And it's basically the proposed rule will reinstate and provide additional protections for different communities so that people can continue to enjoy all of the benefits and protections of the ACA and the plans under the ACA. We also have our public charge update this is for people who work with immigrant communities. As you know, during the previous administration, there were a lot of rules regarding the public charge that really prevented a lot of people in the immigrant community from accessing healthcare. For the most part, undocumented immigrants are not really eligible for many benefits such as SNAP or Medicaid, but in certain localities or in exceptional cases where they may be eligible, the public charge rule was really hindering the ability for them to access healthcare because it would jeopardize their ability to access a green card or apply for other relief services under U.S. Immigration and Customs Services. So we finally have a new finalized rule which changes the definition of public charge, and it essentially undoes the August 2019 rule, and will basically say that if you receive SNAP or Medicaid, it's not going to hinder your ability to move forward in your immigration procedures, unless it's a long-term institutional Medicaid type of situation. So great news all around there. And now we move on to Medicaid Unwinding. So as many of you are familiar, during the COVID-19 pandemic, Congress passed legislation requiring continuous Medicaid enrollment. So if you had Medicaid, you've been able to stay on Medicaid without having to file for a redetermination based on any changes in your income. Unfortunately, with the public health emergency likely ending soon, people will have to actually provide the updated applications for redetermination of their eligibility for Medicaid. The good news is that any end to the public health emergency will require a 60 days notice, and it will be a process that will likely take about 14 months to fully complete. And so a lot of states have continuously been planning for this. It has been funny because every time we're given a date for what would be the expiration of a public health emergency, it then just kind of keeps getting postponed. But there are serious concerns in terms of funding and staffing, because essentially the fear is that there will be some states that are really just not ready for Medicaid unwinding. And so the fears people would be purged off Medicaid without being properly guided into another health insurance option, into the ACA exchanges. So there's a lot of work to do on the ground, and we will definitely be having a panel discussion on this, I believe, tomorrow. So feel free to look into that session in terms of how should we be working in partnership with state health departments and on the ground to ensure that people who are no longer eligible for Medicaid do end up in the right hands and under a health insurance plan. So again, there's a lot going on here, and it really varies by state. So please, I think as we have this summit, feel free, this is something that we'd love to have everyone have a conversation on, so that we can see how we can best support you in your efforts through open enrollment to address this issue. And also just moving forward, how we can best support different communities in different states, since they're all kind of in a different place when it comes to being prepared and ready. Some states have allowed, have continued to send redetermination applications to people, leaving it up to them to complete them. And that has, for people who have completed them, it's meant that there are going to be less people who fall off Medicaid automatically here. But there's just a lot to do in terms of reaching different communities and explaining what's going on, and that they really need to start filling out that paperwork and figuring out next steps. So lastly, we have our COVID update. So unfortunately, Congress has not passed additional funding for new supplies in terms of testing and vaccines. There is also not just COVID-19, but the monkeypox outbreak, where we also need supplies, diagnostics, and vaccines. I know that Congress has come on an agreement for a continuing resolution, which is basically saying we're going to keep spending money until we pass a budget. An appropriations bill. That appropriations bill probably won't be ready until the end of the year. And I would suspect that it's at the end of the year where we're going to finally see some kind of package for COVID-19 and monkeypox. However, it seems that it won't be as large as we need it in order to go back to providing the robust services of providing free tests and reimbursing everyone, regardless of whether they have health insurance or not, for being able to receive a vaccine. So already we see the effects of this. The USPS service for test kits has ended. So if you recall, you were able to order test kits through USPS. At one point, you could receive 4 or 8 of them. That has ended, and a lot of people are going to see the commercialization of COVID-19. So people will have to start buying test kits at pharmacies rather than having the local health departments or clinics just offering them for free. When it comes to vaccines, insurance plans will likely still be required to provide these vaccines at no cost sharing to patients. However, it leaves uninsured populations very vulnerable in terms of not being able to get vaccinated or boosted from new variants. And it looks like the trend will be that every year we'll likely have a variant-specific vaccine for COVID-19. So it's very concerning, and we're hoping that Congress will look at these populations and continue to pass some sort of funding and relief. But that's something that we are concerned about, and we will continue to monitor and educate communities on any resources and how they can continue to get tested and vaccinated, ideally for free. And with that said, the CDC has begun the rollout of Omicron-specific boosters. They're now available at pharmacies and vaccination clinics nationwide. There's one near you. Please visit vaccines.gov for information there. That is actually my last slide, but one slide that I did not incorporate here, but I'll just also mention is there is a lot going on nationally in terms of discussing mental health. And Congress did pass the Safer Communities Act, which provides some new avenues for Medicaid reimbursements for mental health services provided in K-12 schools. It will be very interesting to see how we can continue this national conversation around mental health by advocating for other policy solutions to just make mental health more affordable. And so that's something else that, I'm sure that as you are enrolling people, that may be a reason why they finally may want to look into the ACA exchanges for healthcare, is to have that mental health coverage and service. So that's something that we at YI also care very much about and look forward to hearing your thoughts on. I am now going to open it up to a Q&A if you have any questions. Again, for a lot of these, they can get very technical, and we have panel discussions coming up for the rest of the day today and tomorrow. But I am happy to answer any pressing questions that you have now.
Hey, Martha. I think you mentioned this, but can you just remind us, do we know if the family glitch fix is going to be ready for 2023?
Nina, I know you've been covering our Get Covered updates, so I don't know if you have an update on that, but I haven't seen anything. I know that it's the goal, but ideally we would have to have a final decision very, very, very soon.
Yeah, that's what I've heard as well. It has actually moved to OMB, which means it's close to being finalized, but it is expected to be ready for 2023.
Yes, so hopefully, in the next week or so, we will see that roll in time for November 1st. But that's very exciting. And it's also just a huge difference with the administration that we currently have, right? Like with the expansion of the American Rescue Plan subsidies, we're just seeing the highest enrollment rates ever. And that has to do with making healthcare more affordable, and the family glitch will even make it even more affordable for people. So that's very exciting that people are empowered to access.
Great. One other point of clarification, those preventive services that are currently free, nothing's changed with that yet. We're good for now.
We are absolutely good for now. It's something that we are monitoring, that case from Texas, but as of right now, where everything that is required to be covered by the ACA, all those preventative services, cancer screenings, contraception services are continuing to be required. It is unclear if that ruling will be able to take effect, or if it would just kind of quickly go through an appeals process after appeals process, and then kind of hopefully not make it to the Supreme Court. But again, this is why it's so important to be engaged. The role, as navigators, the role is enrolling people, but there's a promise behind that, right? Like if these screenings are not required, the quality of health insurance goes down. And so the value goes down, and less people are motivated to pay the premiums, even if they are now so much lower, because they just won't see the value in it when critical screenings and preventative services are not covered. So, these court cases are truly an attack on dismantling the ACA. And it's a shame that we're still seeing them in 2022 after a pandemic. So it is scary, it's concerning, and that's why we included it in our slides here, because it's so critical that people who are doing this work understand the broader landscape and hopefully get engaged in the advocacy efforts as well, to protect the ACA and the services that we've been able to provide to people through it.
Yeah, unfortunately, I think a lot of folks who are with us today are familiar with all of those attacks and challenges that we've been through over the last more than a decade. Another question for you, and if folks have any other questions, please feel free to put them in the Q&A box, and we will be happy to send those over to Martha. But Martha, are you You know, in the last reconciliation package, there was some talk of a Medicaid coverage gap fix.
Mhm.
Is there still hope for that, or has it gone back to kind of state level decisions?
I think there were, I don't want to say there's no hope, because a lot of that depends on who our electeds are in Congress. When there is political will, then that fix could absolutely happen. But it's a matter of having that political will, that motivation, the right leaders in Congress to vote for such a fix. Otherwise, until we have that in Congress, it is up to the states. So, you know, another reason to just think about how we can be civically engaged in these efforts.
Thank you, Martha. We're holding out hope still, especially because a couple of other states are starting to talk about Medicaid expansion. So it's still moving. Have one comment in here that I think I can cover. I'm confused as to whether consumers need to enroll and pay before the 15th of the month, or if they can wait until the last day of the month to be covered the upcoming month. So there's this rule, the rule of the 15th, that happens with some special enrollment periods where you have to enroll before the 15th of the month for your coverage to start on the 1st of the following month. If you enroll after the 15th of the month, it skips a whole month, and then starts on the 1st of that, I guess, second month. During open enrollment, that doesn't apply. If you apply during open enrollment, your coverage starts January 1st, first thing next year. As far as payment, people need to, you know, get their due date from their insurers and pay whenever that's due to keep their coverage. Okay, I think that's all of our questions. Any last minute burning questions for Martha? Okay, that's it for you, Martha. Any closing thoughts?
I'm just really excited for this summit, because I know it's going to provide so much more information and resources. So I hope everyone stays engaged throughout the panel discussions. We are bringing in some incredible speakers. And so please stay engaged, stay tuned. Thank you, everyone.
Okay, and with that, we'll see you all back here in about 14 minutes for the next session.